specialize in infectious diseases in the Caribbean. With the HPV pandemic going on, me and my team will be informing you about this microbial disease and ways we can reduce and prevent the spread of HPV. So listen up and buckle up as you may save you and your loved ones a trip to the Princess Margaret Hospital. So what is HPV? Well, HPV is short for human papillomavirus, and fun fact, HPV is one of the most common sexually transmitted infections in the world. The human papillomavirus is the causative agent of this infection, and this virus belongs to the family of Papillomaviridae, in which more than 100 types have been recognized up to the date. It is a viral infection that commonly causes skin or mucous membrane growth. Some types of HPV infection cause warts, lesion on your tongue, tonsils, soft palate, within your larynx and nose, and some can even cause different types of cancer. These cancers can be benign or malignant epithelial tumors. Fortunately, most HPV infections don't lead to cancer, but some types that do can cause cancer of the lower part of the uterus, anus, penis, vagina, vulva, and back of the throat. In most cases, your body's immune system defeats an HPV infection before it can create warts. But when they do appear, they can look like this. So these are common warts, flat warts, plantar warts, and genital warts. HPV infection occurs when the virus enters your body, usually through a cut, abrasion, or small tear in your skin. The virus is highly contagious and transferred primarily through skin-to-skin contact. Ways you can become infected include infection through genital-to-genital contact, through hand-to-genital contact, and this type of transmission is less likely, but it is not impossible. Another way that HPV can be spread is from mother to baby. This happens in rare cases where an infected mother can pass HPV to her baby during childbirth, potentially causing respiratory papillomatosis in the infant. And lastly, HPV can be transmitted using the personal items of an infected person. So how can we prevent HPV now? First on my list is HPV vaccines. And the HPV vaccine, like Gardasil 9, protects against the most common high-risk and wart-causing HPV types. It's most effective before exposure to the virus, so it's recommended for children ages 11 and 12. However, the vaccine can be taken up to the age of 45. Reducing your numbers of sex partners can also assist in preventing HPV, as the more partners you have, the higher the chance of encountering someone with HPV. Having a mutually monogamous relationship with an uninfected partner reduces the risk as well. It's also good to practice safe sex. Using a latex condom provides a barrier that reduces skin-to-skin contact and lowers the risk of HPV transmission during intercourse. They don't offer full protection since HPV can infect areas not covered by a condom, but it still helps in reducing the risk of infection. It's also good to get regular pap smears and HPV tests, as routine screening helps detect abnormal cell changes early, allowing for treatment before they develop into cancer. It's also good to avoid direct contact with warts. HPV can be spread through skin-to-skin contact, including touching or sharing personal items with an infected person. Avoiding direct contact helps to reduce transmission. Using your own personal items and not sharing with others is a good way to minimize the risk of HPV spreading. So all of these methods and practices can help reduce the spread of HPV, but of course, the safest method is sexual abstinence.
Human papillomavirus, also known as HPV, has been studied for decades. According to the National Library of Medicine, Greek scientist Dr. George N. Papanikolaou first observed precancerous HPV-related lesions in vaginal smears. In 1949, M. Strauss and his team used electron microscopy to describe HPV for the first time. By 1963, Crawford and Crawford had analyzed its DNA structure in their study. Today, HPV remains one of the most common STIs with major effects on healthcare and society. While vaccines are available, they are at a high cost at most private clinics, sometimes hundreds of dollars, and this can discourage people from getting the vaccine. However, in the Bahamas, government-funded community clinics offer the vaccine for free to us Bahamians. Beyond prevention, HPV also causes genital warts and is a leading cause to cervical cancer. With continued education and accessible health care, we can reduce the burden of this virus.
Good evening. Tonight we take a closer look at human papillomavirus, HPV, and the unique challenges it presents right here in the Bahamas. While HPV is the most common STI worldwide, not all countries face it the same way. In high-income nations, widespread vaccination and routine screenings help control infections and prevent cervical cancer. But in the Bahamas and other Caribbean nations, healthcare access, vaccine hesitancy, and cultural stigma creates gaps in prevention. The HPV vaccine is available but not widely used, and cervical cancer screenings remain inconsistent, especially in lower-income communities. Unlike in wealthier nations where public health campaigns normalize HPV prevention, Caribbean countries face deep-rooted misconceptions and social taboos, making open discussion difficult. Add to that the economic disparities that limit healthcare access, and many Bahamians remain at risk for preventable diseases. With our high tourism rates and small, close-knit population, targeted education and policy changes could help bridge these gaps. Expanding vaccine programs, making screenings more accessible, and breaking the silence around HPV are critical steps toward protecting Bahamians for generations to come. Stay with us as we continue to bring you the latest on public health and wellness.
CARICOM nations have been doing the necessary research and training to fight against the HPV virus. It is advisable that members of the public consult their local clinics and healthcare facilities to do their annual pap smears and other tests to detect early signs of HPV. These CARICOM countries have took several different approaches to conduct HPV screening in their respective countries. These approaches include a pilot program to integrate HPV screening into primary healthcare, self-collection HPV testing, and a FAST system, which involves fast tracking, affordable care, systematic tracking, and timely treatment. It was said that those who can't afford health care were the leading group to have HPV. CARICOM is now creating a way to make testing accessible to everyone. People who are diagnosed with HPV can still live their lives as normal. Their only change in life is their sexual partners and sexual activities they participate in, due to the HPV virus being commonly found throughout sexual activities. Remember to stay protected and get your annual tests and vaccines done for a safe future.